I'm Stephen Mathews, Chief Executive of Cedar Foundation, and welcome to this video clip of our activities over the last year. It's been a year of very considerable range of successes, and I'd like to outline both those and some of the challenges that we've been involved in throughout the organisation. The year was the second year of our 3-year strategy, Building Better Futures for People with Disabilities. Everything that we did during the course of the year was built around 4 strategic themes: supporting individuals and families, empowering service users, building capacity, and improving and innovating, all working to our vision of the future of a society accessible to all. Our children and young people's services had a particularly busy year. For example, our Outlook service supported 168 families across the various regions. The Western service in particular was a new service with the support of a number of volunteers, supported 15 families across the Western Trust area. In addition, the InReach project supported children with very complex disabilities. A total of 19 families were supported. Youth Matters likewise supported 205 young people across 86 activities. This included the development of an app for smartphones and tablets. The app is designed to provide young people with disabilities with information about Cedar and its services, and allows them to keep up to date with a range of social activities and personal development programs. Right for You, which supports young people with autism, supported 40 children and young people in the Belfast and Western Trust regions, and this included activities such as participation in World Autism Awareness Day at Londonderry's Guildhall. Transitions too had a very busy year, supporting over 224 young people, supported through 55 schools. They achieved a remarkable 87% positive outcome, moving those children who had left the service into training for success, further education, and in some cases higher education. There have been an important number of developments within our living options services, with the support of tenants, residents and families. This included the integration of West Belfast supported living services into Cedar, and my thanks to all those involved for their support during this process. An important aspect of this is the plans to progress the closure of Dipna House and the development of Mornview supported living apartments, which will be well underway by September of this year. In addition, we've worked closely with Triangle Housing Association and the South Eastern Health and Social Care Trust to commission a new supported living project in Lisburn. Agreement has been reached to purchase the land, planning permission has been secured, and we aim to have this project on site in mid-2014. But all of this could not have taken place without the very strong leadership of the Living Options team and the support of the staff across the piece, all built around effective staff development programmes such as our NVQ and our QCF management and leadership development. Our target for 2015 is to have 75% of staff to have one of these qualifications over the course of the year. Floating Support equally had an excellent year, supporting 271 people across the service, with 87% of the completers having a positive outcome. Very positive outcomes were achieved against the 5 strategic indicators set by supporting people, with over 80% reporting positive improvements in their lives against a target of 70%. Very high levels of user satisfaction were also maintained. 90% reported they were very satisfied in Floating Support, an increase of 9% against the previous year, which was an excellent outturn. Our vocational employment and training programs, including our brain injury services, too have had an exceptional year. Training services supported nearly 500 service users across its various programs, and brain injury services supported 230 people in various ways. An exceptional range of outcomes were achieved for all those involved in the programmes, sustaining a 90% positive outcome into either employment, further education or community outcomes. To achieve this, we worked in partnership with many organisations, for example Digital Assist, a business in the community initiative that aims at using the IT skills and expertise of employees in different organisations to get people of all ages and backgrounds connected to the world of ICT. Partnership with employers was also important as ever, with over 250 employers supporting our programmes through projects such as job support or work tasting opportunities. Again, we looked at innovative ways of supporting people, and this included self-employment. This was explored as well in a partnership between Invest NI, Disability Action, through their conference encouraging entrepreneurship amongst people with disabilities. But again, core to a lot of service development and innovation was effective staff development. An example of this was the work that was undertaken by the Brain Injury Staff Team and the Southern Trust, who completed a QCF Level 3 and Allied Health Professional Support. This ensured shorter-term, more intensive programmes that meant we could support more people in all of our services. Social and community networking continued to progress as a service area, supporting 452 people across all its projects. The Connections project ended successfully with a number of concluding conferences and the transfer of participants into an expanded range of active citizen projects. Very high levels of satisfaction were achieved through this process, with users expressing a 97% level of satisfaction with the support that they had received. Social and community networking continued to provide innovative approaches in different ways, for example, securing the support for active Belfast projects such as Game On, an inclusive bocce sports project in Belfast, or participation in the North Antrim Community Network's Inclusive Disability Project, Drawing Together. All demonstrate a strong commitment to innovation. The user forum, supported through the Social and Community Networking Service, has gone through a number of changes in the year, now supporting 116 representatives from 5 local fora, supported by local chairpersons. They have completed an exceptional programme of representation, for example, participation in the Western Health and Social Care Trust review and the modernisation of day opportunities. All of these included events such as celebrating International Day for People with Disabilities with the support of the Lord Mayor of Belfast. Our commitment to innovation and improvement through cutting-edge research was amply demonstrated through the EU Commission-funded research project Back Home, which aims to produce a device using brain-computer interface technology to enable people with disabilities to be more independent in their own home. Recognition of all of our work was achieved towards the end of the year when we received the European Foundation for Quality Management All-Ireland Excellence Award, a fitting recognition for the outstanding commitment of all involved in Cedar. It's been an exceptional year with an exceptional range of achievements, so I'd like to place my thanks on record to all of those who have funded our work, to the staff who have been engaged in providing exceptional services, but most importantly to the service users who have supported us in working to a future to enable people with disabilities to be more actively involved in their communities. Thank you for watching this.